A 67-year-old man woke up feeling fine. No chest pain, no shortness of breath, no warning signs whatsoever. He felt good, normal, like any other Tuesday morning. He did what he always did, jumped straight out of bed, walked to the bathroom, turned a shower to cold because he'd read somewhere that it was good for you, and stepped in. 20 minutes later, his wife called 911. I was a cardiac surgeon on call that morning. I scrubbed in and I operated. Thankfully, he made it. But I've seen cases just like his that ended very differently. Very differently. What happened to him was not a freak accident. It was not bad luck. It was a series of completely avoidable mistakes. Mistakes that millions of people over 60 make every single morning without even realizing it. Today, I'm going to show you exactly what they are and what to do instead. So why is the morning so dangerous? Let me give you some numbers first. Studies published in the American Heart Journal show that heart attacks are significantly more likely to occur between 6 o'clock and 10 in the morning than at any other time of day. We're talking roughly 40% higher risk during those 4 hours. 40%. That's not a small statistical blip. That's a pattern cardiologists have been tracking for decades. We even have a name for it. We call it the morning surge. And if you're over 60, that surge hits harder and faster with far less margin for error than it did when you were 40. Here's exactly why. While you sleep, your body runs in a kind of low power mode. Heart rate slows down, blood pressure drops, your nervous system is quiet. But the moment you start waking up, even before your eyes open, your body begins shifting gears hard. It's like flooring the accelerator in a car that's been sitting in a cold garage all night. The engine isn't ready, the oil hasn't circulated, and you're already demanding full speed. Add a few common habits most people think are healthy, and you have a recipe for a cardiac event. Here's something most people don't realize. Your stress hormones, cortisol and adrenaline, don't wait for you to get up. They start rising about an hour before you even wake up. Your body is literally preparing you for the day while you're still dreaming. By the time your alarm goes off, cortisol levels are already climbing fast. Adrenaline follows right behind, and together they hit your heart hard. They do 3 things to your heart almost simultaneously. 1, your heart rate jumps. 2, your blood pressure rises. 3, your blood vessels constrict. All of that happens in minutes, sometimes seconds. Now, when you're 35, your cardiovascular system handles that surge without breaking a sweat. The vessels are elastic. The heart is strong. But after 60, the picture is very different. The vessel walls are stiffer. The system doesn't adapt nearly as fast. There may be plaque built up inside the arteries. Plaque you don't even know about because you feel completely fine. And when that hormonal wave hits a vessel with a vulnerable plaque, the force can crack it. A cracked plaque triggers clotting. And a clot in a coronary artery is a heart attack. That's not a worst-case scenario. That's the mechanism. That's what I see on the operating table. Before you've had a single cup of coffee, your heart is already working harder than an hour ago. What you do in the next 5 minutes either helps it manage that load or makes it dramatically worse. Ask yourself right now, do you know what your blood pressure is first thing in the morning? If not, that's the first thing to change. Here's one that surprises people every time I bring it up. After 7 or 8 hours of sleep, you are mildly dehydrated every single morning. No exceptions. You haven't had a drop of water all night. You've been breathing, which constantly loses moisture from your body. The result? By morning, your blood is measurably thicker and more viscous than it was the night before. Think of it this way. Imagine your heart is a pump and your blood vessels are the pipes. When the fluid running through those pipes is thin and flowing freely, the pump doesn't have to work very hard. But when that fluid thickens, the pump has to push harder to move the same volume. Every single beat requires more effort. And thicker blood doesn't just make the heart work harder, it clots more easily. The risk of a thrombus is significantly elevated in the morning. Research confirmed that clotting factors are at their highest activity levels in the early morning hours. The timing is not a coincidence. This is one reason why strokes and heart attacks cluster so heavily in that 6 to 10 window. It's the hormone surge, plus the thick blood, plus the stiff vessels all hitting at once. A triple threat for any heart over 60. The fix for this is almost embarrassingly simple. A glass of water, room temperature, before anything else. Before coffee, before medication. Before you check your phone, hydrate first. One of the lowest effort, highest impact habits you can build, and almost nobody does it consistently. Keep a glass of water on your nightstand tonight. Make it the easiest habit you've ever built. Let me be honest with you. The cold shower trend has exploded over the last few years. Social media is full of it. Guys jumping into ice baths at 5 in the morning, talking about discipline and mental toughness. Cold exposure has real benefits. I won't deny that. But here's what those videos never mention. Timing matters enormously. For anyone over 60, a cold shower first thing is a serious cardiac stressor. Here's what happens the moment cold water hits your skin. Your body triggers something called the cold shock response. Blood vessels near the skin constrict instantly to protect your core temperature. Your heart rate spikes. Blood pressure shoots up. We're talking a systolic pressure jump of 20, sometimes 30 points in a matter of seconds. That's a significant cardiovascular shock. Now, remember where we are in the morning? The hormone surge is already pushing your pressure up. Your blood is already thicker than normal. And now you're adding a sudden violent vascular constriction on top of all of that. For a healthy 30-year-old, the body handles it. For a 65-year-old with some arterial stiffness, that spike can be the trigger. It can crack a plaque. It can cause a coronary spasm. It can provoke a serious arrhythmia. The gentleman I told you about at the beginning, the cold shower was his trigger. His arteries were not in terrible shape, but not in perfect shape either. In that combination, the morning surge plus the cold shock was simply too much. So what do I recommend? Start warm around 37 degrees. That's body temperature. Let your body ease into the transition first. If you love cold water, save it for the last 30 seconds of your shower. By that point, your vessels have had time to dilate. Your pressure has stabilized slightly, and the cold shock is far less severe. One small adjustment, big difference for your heart. How do you get out of bed in the morning? Be honest. Most people go from horizontal to vertical in about 2 seconds. Alarm goes off and they're up, feet on the floor moving. I understand you've got things to do, but that rapid transition is problematic. Here's the physiology. When you're lying flat, your blood is distributed relatively evenly throughout your body. The moment you stand, gravity pulls a significant volume of blood downward toward your legs and abdomen. Your heart has to respond immediately, constricting vessels, increasing heart rate to maintain adequate blood pressure to the brain. In a young person, fast and efficient. In older adults, that reflex slows down. The vessels don't respond as quickly. We call this orthostatic hypotension. Blood pressure can drop 15, 20, sometimes 30 points within seconds of standing. Dizziness, lightheadedness, that gray, foggy feeling when you stand up. Sound familiar? A lot of people over 60 experience this and assume it's normal. It isn't. It's a warning signal from your cardiovascular system, and the consequences go beyond discomfort. Orthostatic hypotension is a leading cause of falls in older adults. Falls are one of the most serious health risks in that age group. A bad fall at 65 can start a life-threatening chain of events. For someone with a heart condition, that sudden pressure drop forces the heart to compensate aggressively, spiking rate and output in seconds. In a vulnerable heart, that compensatory spike can trigger an arrhythmia. In severe cases, it can precipitate a cardiac event. The solution costs you nothing, just 10 extra seconds. Before you stand up, sit first on the edge of the bed for a full minute. Let your feet hang, rotate your ankles. Let gravity do its work gradually. Let your blood pressure adjust before your heart goes from 0 to 60. 10 seconds lying, 30 seconds sitting, then stand slowly. That simple transition can prevent a fall, prevent an arrhythmia, and something far worse. I've seen it happen both ways, and I know exactly which side of that I want you on. Let me ask you something. Are you currently taking a blood pressure medication, a diuretic, sometimes called a water pill? If the answer is yes, there's something your doctor may not have mentioned, and I think you need to know about it. Diuretics work by helping your kidneys flush excess fluid from your body, reduce fluid volume, reduce pressure. They're effective. They're widely prescribed. But here's the catch. When your kidneys flush fluid, they also flush minerals, specifically magnesium. And magnesium is not a minor player. It regulates the electrical signals that control your heartbeat. It keeps the rhythm steady. It helps the heart muscle relax properly between beats. When magnesium levels drop quietly, the heart becomes electrically unstable. The rhythm can become erratic. Palpitations, skipped beats, or more serious arrhythmias, and it can happen with no obvious warning because the morning is already the time when your heart is under the greatest stress. A magnesium deficiency hits hardest right then. I have seen patients with morning arrhythmias that completely resolved once we identified and corrected a magnesium deficiency. More common than people think. If you're on a diuretic, ask your doctor at your next appointment to check your magnesium level. A simple blood test, 2 minutes. That information could be genuinely invaluable for your heart. Don't assume everything is fine just because nobody checked. Now, I know what some of you are thinking. Dr. Adewale, I walk every morning. My doctor told me exercise is good for me, and your doctor is absolutely right. Exercise is one of the best things you can do for your heart at any age. Full stop. But, and this is a significant but, timing and intensity in the morning matter more than most. People realize, here's the problem. In the morning, cortisol is high, blood pressure is elevated, blood is thicker, and the heart is already working harder than usual. Now imagine jumping straight into a vigorous workout. In that state, no warm-up, just go. Your heart rate surges rapidly on top of an already elevated baseline. Blood pressure climbs higher on top of an already elevated morning pressure. And your coronary arteries, already slightly constricted from the morning hormonal surge, are being asked to deliver dramatically more blood to a working heart muscle. Research published in Circulation found that vigorous exertion in the early morning carries a meaningfully higher risk of triggering a cardiac event in adults over 60. This doesn't mean don't exercise in the morning. It means don't sprint before you walk. Literally give your body 20 to 30 minutes to wake up, hydrate, and stabilize before you do anything strenuous. A gentle walk is perfect. Slow stretching is perfect. Save the intensity for after your body has had time to shift properly into active mode. And ask yourself, when you exercise in the morning, do you warm up first or do you just start? Tell me in the comments. All right, you now understand why the morning is dangerous. So let's talk about what to actually do about it. Because knowledge without action is just worry. And I'm not here to make you anxious. I'm here to give you a plan. This is what I call the 5-minute morning protocol. No cost, no equipment. Meaningful cardiovascular protection every single morning. Minute 1, conscious waking. When your alarm goes off, don't move yet. Stay exactly where you are. Take 3 slow, deep breaths. In through the nose, out through the mouth. This activates the parasympathetic nervous system, the calming branch, to counteract that cortisol surge before it peaks. Just 3 breaths, that's all. One of the most powerful tools for cardiovascular protection, and it costs you absolutely nothing. Minute 2, hydrate before you stand. Keep a glass of water on your nightstand. Before your feet touch the floor, drink it room temperature the whole glass. This begins thinning your blood, reduces the clotting risk, and gives your cardiovascular system something to work with before the demands of the day begin. Minute 3, sit before you stand. Roll to your side, push yourself up slowly, and sit on the edge of the bed. Don't rush this. Rotate your ankles in circles 5 times each direction. This activates the muscle pump in your calves, pushing blood back up towards your heart. Minute 4, gentle movement. Still sitting. Slowly roll your neck, side to side. Shrug your shoulders, stretch your arms above your head. You're waking up your muscles gradually, increasing circulation gently, giving your heart rate a chance to rise at a pace it can actually manage. Minute 5. Stand slowly, place both feet flat on the floor, press through your legs and rise at half your normal speed. Stand still for 10 seconds before you take your first step. Let your blood pressure confirm its new position before you start moving. 5 minutes. That's the entire protocol. And on the days when you do this, your heart starts to date protected, not ambushed. Here's what I want you to sit with for a moment. Everything I've described today, none of it is exotic. None of it is rare. This is happening in bedrooms across America, every single morning in houses just like yours, to people who feel completely fine, who have no idea. That's the part that gets me. After 15 years as a cardiac surgeon, the cases that stay with me are not the complicated ones. They're the preventable ones. The 68-year-old retired teacher who had a cardiac event getting out of bed on a Wednesday morning. The 71-year-old grandfather who stepped into a cold shower and never stepped back out. These were not sick people in the traditional sense. They were people who didn't know what I'm telling you right now. And here is the most important thing I'll say in this entire video. The morning danger zone is real. The research is unambiguous, but it is also one of the most manageable risks in cardiovascular medicine. Because unlike genetic predisposition, unlike decades of dietary history, your morning routine is something you can change today, this afternoon, before tomorrow's alarm goes off. You don't need surgery. You don't need a new prescription. You need 5 minutes and the information you now have. The man I operated on that morning, the 67-year-old, he recovered fully. He came back to see me 3 months later, and the first thing he said was, "Why didn't anyone tell me this before?" That question has stayed with me ever since. It's a big part of why I make these videos. Now the question is, what are you going to do with it? So let's bring it all together, because I want you to leave this video with something concrete, not just a vague feeling of worry. Here are the 5 things I want you to remember and act on starting tomorrow morning. First, before you move a single muscle, take 3 deep breaths. Let your nervous system ease out of sleep mode before your heart is asked to perform. Second, drink a full glass of water before your feet touch the floor. Keep it on your nightstand tonight. Make it the easiest habit you've ever built. Third, sit on the edge of the bed for a full minute before you stand. Rotate your ankles. Let your blood pressure find its footing before you do. Fourth, if you're on a diuretic, ask your doctor to check your magnesium at your next visit. 1 blood test, that's all it takes. Fifth, if you exercise in the morning, give your body at least 20 minutes to wake up before you raise your intensity. Walk before you run in every case. Now, here's my question for you, and I genuinely want to hear your answer in the comments. Which of these habits are you already doing, and which ones surprise you the most today? Tell me, because those comments help me understand what to cover next. I read every single one. If this video gave you something useful, share it. Not for me, for the person in your life doing exactly what I described every single morning. They may not know they need this yet, but you do. And that's exactly why you're here. Take care of your heart. It has been working for you every single minute of every single day without asking for anything in return. Give it 5 good minutes in the morning. It is a fair trade, and it starts tomorrow. One last thing. Everything I've shared today is based on published cardiovascular research and my clinical experience as a cardiac surgeon. But your situation is unique. Before making any changes to your medications, exercise routine, or morning habits, please talk to your own physician. They know your history. I don't. This is education, not a prescription. Use it as a starting point for that conversation. I'm Dr. Kevin. Oavali.